The big question is, where are all the new cases coming from? Dr. Maria Simbra explains why experts are having a hard time trying to figure that out, at least in some cases.
With case numbers rising, the time for targeted closures has passed, especially when it's been hard to pinpoint where the coronavirus infections are coming from.
As we're seeing an explosion in cases around the world, in the United States, and certainly in our area, I think that the targeted restrictions get even more difficult to be able to do.
Some transmission has occurred in bars, restaurants, and gyms, but that's a small sliver of cases.
Increasingly, it's not so much it's small gatherings at households is where we're seeing a lot of the transmission happen.
From Europe to New York City, 75 to 80% of positive cases have no known source. Contact tracers can't pinpoint enough contacts to map the spread.
As there are more and more cases to contact trace, that can be overwhelming for the people that are trying to track the cases, and it can be hard to get in touch with everybody. What we're seeing locally that's really disappointing is people are not picking up the phone when contact tracers call, and they're not being honest about what the exposures have been.
And with a long incubation period, people can spread the virus without knowing they have it.
There is a lot of virus in our community right now. People that are sick, people that don't know that they're sick, and you can contact trace infections that you don't know about.
With no clear source of many infections, what public health measures might work?
The blanket stay-at-home advisory is really, our best chance at curbing the spread. And so, any even small gathering is an opportunity for that virus to be transmitted person to person. And so really avoiding any gatherings with people that do not live in your household for now.
For hospitals to have enough beds and staff, getting the number of cases down is important. Dr. Shively says in our area, we aren't running out yet, but the upward climb in numbers makes it a concern. I'm Dr. Maria Simbra, KDKA News.